A client of mine early on, typing gave him extreme pain in his wrists. And the first step we did in graded exposure was just to have him imagine typing, and I had him hold his hands out like he was going to type. And what he noticed is that his pain started even just doing that, which gave him a lot of confidence that, oh, my brain is expecting pain even before the activity begins. Now, that's not always the case for everyone, but it's a good sign for us that this is a neuroplastic pain condition, which then gives us confidence that if we just soothe our minds, soothe our brains, then that sensation can go away.
Hi, everybody. For those of you who are new, welcome. For those of you who are returning, thank you so much. We love to see our little returners. I'm Rachel Amondson. I'm a social worker and mind-body coach. I've been doing this work since I worked at the Pain Psychology Center with Daniel about 9 years ago. And I'm one of the group leaders on Curable. And yeah.
And your resume goes on and on and on. We
Yeah,
don't have time for that, Rachel. Come on.
No.
Hi, everybody. My name is Daniel Lyman. I'm a licensed clinical social worker, which means I'm a psychotherapist. I am the executive director of, I was trying to think of my resume now. I'm the executive director of the Mind Body Therapy Center, which is a therapy group practice dedicated to helping people overcome chronic pain. I was a founding member of the Pain Psychology Center, where pain reprocessing therapy was born and came out of, and I'm also one of the lead trainers of the Pain Reprocessing Therapy Center. So all that is to say, chronic pain is our stuff. Rachel and I love talking about this and love helping people through all of that, and that's why we are here today.
Exactly. And we are really excited to talk more about graded exposure, give everyone a better idea of what it is and how to do it. And we'll actually show a clip of Daniel working with someone and me working with someone, and then we will kind of talk about it because, yeah, it's a really, I think, helpful tool in this work of overcoming chronic pain.
It's a helpful and common tool in this work. So let's just briefly talk about what graded exposure is before we go into the tape here. And graded exposure is, I mean, it's exactly what it sounds like, but it is exposing somebody to the thing that they are afraid of. And in our case, oftentimes the thing that is causing them somatic symptoms. And by that, I mean the thing that's causing you pain, the thing that's causing you these sensations in your body. And what we're going to do when we do utilize graded exposure as a tool is gradually and slowly expose you to that thing as a way to help overcome the fear and anxiety related to that. So for example, if you get a lot of, let's say, pain when you sit, what we're going to do is we're going to slowly expose you to sitting. And that actually may start, as you'll see in the video that I do, that may start with just exposing you to the idea of sitting, not even to sitting itself. So that can be what we call imaginal exposure, which is kind of one of the first steps that happens in graded exposure. I've worked with many clients where a client of mine early on, typing gave him extreme pain in his wrists. And he had that pain for almost 7, 8, maybe 9 years. And the first step we did in graded exposure was just to have him imagine typing, and I had him hold his hands out like he was going to type. He wasn't even touching a keyboard or anything, but just holding his hands out. And what he noticed is that his pain started even just doing that, which gave him a lot of confidence that, oh, my brain is expecting pain even before the activity begins. Now, that's not always the case for everyone, but it's a good sign for us that this is a neuroplastic pain condition, which then gives us confidence that if we just soothe our minds, soothe our brains, then that sensation can go away.
Yeah.
That was a lot of talking. Rachel, what do you think about that?
No,
How did you define graded exposure?
Well, I first off, I love this topic because it's kind of where self-compassion is sort of my favorite tool. I think graded exposure is kind of like your baby. You're so good at it. Daniel has actually done graded exposure with me because I cannot stand the sound of chewing.
It's what I do to all my friends. So be careful if you become my friend. We're going to be hanging out on Friday night and do graded exposure. This is what therapists do for fun.
But what happens is we get these conditioned responses. So, for example, I was getting chronic headaches, and I was convinced that it was lack of hydration that was causing the headaches. And so then I was constantly terrified that I was going to run out of water. And so I was drinking too much water, and I was getting these headaches. And really, it was just the stressful time in my life that I was going through. But we can really often associate something. Our mind really wants to come up with a cause and effect, right? Why is this pain here and what is happening? And so we create this cause and effect, and then we get these conditioned responses. And so graded exposure is such a helpful tool in kind of breaking that, cycle of your brain expecting this sensation to come on.
I love what you said there, that graded exposure is a way to break conditioned responses, which is a little bit jargony, but I really like that because it's true. So much of what we're experiencing in our body is a conditioned response. And this is true not even in the chronic pain world. This is just true in our daily lives. We expect things to feel a certain way before we do them. And so we have that anticipatory sensation. We have those anticipatory sensations in our body. It's like, my favorite food is pizza, and if I sit here and talk to you all about pizza for the next minute, I'm going to start tasting pizza in my mouth. Not like literally having pizza in my mouth, but I'm going to start knowing what it tastes like to bite into pizza. It's already happening, actually. So there's almost, it's like Pavlovian in a lot of ways, but that's the anticipatory sensations based upon my memory. And my memory is strong enough, my brain is strong enough to cause those sensations, even in the absence of pizza or in the absence of sitting, if we're using that as an example. Should we watch some tape?
Yeah, let's get into one, because then it's always, I think, a little bit more helpful when you guys can see some of this in action. But yeah, as you get that queued up, I will just kind of say once again, it's really just gradually, with so much ease and so much compassion, just gently exposing yourself to that thing that you're afraid of doing, while telling your brain it's safe, kind of interrupting that signal and just retraining your brain to know that this thing that you were previously afraid of, you don't need to be afraid of it anymore. So it's a really cool and helpful tool when it works.
And let me just set this clip up here. This is I'm working with a woman named Amy. When Rachel and I go into these, we don't know what we're doing. We do, we record these. We know which tool we're going to use, graded exposure, but we don't know how we're going to use it with the people that are volunteering. And I started off the call with Amy, and I kind of asked around, and I thought where can we do this? And then she mentioned something about the dentist, and I didn't clock it at first, but then a little bit later I was like, wait a second, we should do an imaginal exposure about this. So you'll see what I'm going to do here. It's not a physical exposure where we have her do some sort of movement or behavior. This is an imaginal exposure, which, as I said earlier, that's kind of one of the early steps in graded exposure. We don't always start there, but oftentimes we do. So let me get this ready here. Earlier you talked about how you were previously at the dentist, and it was very difficult for you to feel a sense of safety there.
Oh, yes, that's true.
And even as you were talking about it, you started to feel that lack of safety here just talking with me.
Yes, yeah.
And now that's manifested in tension in your neck and your jaw. Is that right?
Yes, it has.
Okay, so right now, what would you rate that tension at in those areas on a 10 scale? Let's just do that.
Let's see, compared to where I was when I was there last week, I'd say we're probably in the 6 to 7 compared to what it could be.
Compared to the 10 that it was while you were there?
Yeah.
Okay, so it's still pretty high right now.
Mm-hmm.
Yeah, and that's just from thinking about going.
Yeah.
Yeah, so you can tell your brain is terrified of the dentist.
Yes.
And for good reason. I know you shared a little bit of that history with me. It sounds terrible. So I don't want to minimize that whatsoever. It sounds like an awful history. So of course your brain is saying that is a place of danger. Why the heck would we ever go back there?
Yeah. Except we have to. So.
Right. Exactly. We have to. But our brain doesn't always necessarily understand. It's not logical. Our fear brain takes over and it's just that's a terrible place. Let's not go there.
Yeah, that's true.
So right now, do me a favor, put your hand on your chest for me. And what I want you to do is just take a few deep breaths. We're not going to even do anything crazy. We're just going to breathe here. And I want you to start off this exposure by reminding your brain that right now you are safe.
Right now, I'm safe.
Good. Right now you are sitting in this chair, talking to this schmuck over Riverside. You are totally safe. And go ahead and keep your hand there on your chest if you can. And what I want you to do, let's not even imagine going to the dentist. Let's just think about the dentist right now. Let's just think about the dental work you need to have done. Yeah, I notice your breathing getting a little more labored right now. What are you observing, keeping your eyes closed? What are you observing is happening as you think about the dentist?
Uh, Anxiety and my jaw tensing up,
Okay.
the whole body tensing up, and feeling pain right here.
Okay. Okay. So you notice anxiety is coming up, tension, pain has come up, just thinking about going to the dentist.
Yeah.
All right. What I want you to do is, metaphorically speaking, I want you to run back to that safe place of your breath. Take a deep breath for me. And I want you to remind yourself that right now you are safe. Right now.
Safe in this moment. In this
Yes.
moment, I'm safe.
Good. Good. I'm going to say what I said before. Right now, in this moment, you're not at the dentist. You are sitting in a comfortable chair at home, talking to this schmuck on Riverside. And you are safe. Good. Amy, keep your eyes closed. That's a baby exposure we did right there. And that's awesome. When I say baby exposure, I don't mean to minimize it. What I mean is that's a perfect small step. We always have to start before we take full steps. Before adult steps, we take baby steps, and that was perfect. So what's happening in your body right now? What do you notice?
I'm calming back down a little, and the tension is coming down a little bit, except in my ankles. For some reason, my ankles are getting real tight.
Okay. Yeah. We raised anxiety. It's going to show up in different ways. That's totally fine. Do your best not to judge what's going on in your ankles.
Yeah.
But what we did was just what we call imaginal exposure. And I just want to keep saying it to remind you that you are safe right now.
I'm safe in this moment. In this moment, I'm safe.
Yes, I love that. Next time when you say that to yourself, see if you can bring some levity into the room. Maybe repeat, I am safe in this moment sitting here with this schmuck. With this schmuck, I am safe sitting here. Yeah, exactly. Good.
I'm safe in this moment with the schmuck.
Amy, how dare you call me a schmuck?
In this moment, I am safe with the schmuck.
Yes, exactly. Good. Good. Because, Amy, the honest truth here is when we laugh authentically, it brings down our anxiety. Because you can't laugh when you're truly terrified. We might laugh out of nervousness, but we're not authentically laughing, finding humor in a moment.
Yeah.
So don't be afraid of bringing that kind of humor into it. So let's try this one more time here. Talk to me about what's going on in your body. That's the first step of an exposure here.
Well, the laughing, I'm a little calmer and a little less stressed about things in general.
Good. Good.
And I'm able to ground a little bit into the chair a little bit more.
Good. Great. Now, let's just think about the dentist. We're just going to think about it for, let's say, 10 seconds. Are you thinking about it?
Yeah.
Good. Now, let's bring in the big guns that we just talked about. Say it out loud for me.
I am safe in this moment with the schmuck. And with the schmuck, I am safe in this moment.
Good. 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 Okay. How was that second exposure versus the first exposure? Good deep breath there. Tell me the difference between the first and the second.
I was able to picture a little bit more. I still had the tightness and the pain start up in here, but I was able to picture a little bit more, and I didn't have quite the feeling of escape.
Good.
Yeah,
Amy, take a deep breath for me, and then open your eyes whenever you're ready. I'm so proud of you. That's awesome.
thank you.
That's like a 6, 7 minute exercise, and you proved that you could feel a little bit safer through exposure.
Yes,
And I think what really worked for you is bringing a little bit of levity and humor.
I think so. Yes.
Yeah, don't forget that. That's important. It's hard to do that on our own, of course,
Yeah,
but just keep that in mind. Is that making stupid jokes honestly helps us in those moments.
yeah, yeah. I wonder how the surgeon would react to being called schmuck.
Let's find out. Oh, that's great. But see, there you go. Like even this, I know you have access to that good sense of humor, which is awesome. Let's use that. So
Yes,
great job. That was.
I agree.
How do you feel about that experience?
I feel good about that. It's something I've been wanting to try and do, and have been if almost afraid to try it.
Of course, because it's scary.
Yeah, so that gives me a starting place to build on.
Awesome.
Just getting over that initial hump of even attempting it.
Yeah. And honestly, we always start with the level of fear and anxiety you're talking about. We start with an imaginal exposure where we just think about it. The next step might be literally visualizing in our heads, walk or driving to the dentist or however we get there, and then walking in the door. It would be a little bit more specific. But I could tell even just generally thinking about the dentist was triggering enough. So that was the place to start.
Yeah, definitely.
Great work, Amy. I really appreciate you volunteering for this.
Thank you.
Oh, what a rock star Amy is. And now I'm going to also call you schmuck for the rest of the time.
As I explained, it was like a fairly simple imaginal exposure, but when our fear and anxiety is that high, that's where we want to start. And we want to get to a place where when we do the imaginal exposure, we don't feel flooded with anxiety. Maybe we'll feel a little bit. Listen, very few people love going to the dentist. She may always have some anxiety around that. Yeah, and I want to also, before we go into the next clip, I just want to say that, graded exposure is a more difficult thing to do on your own at first. There are ways to do that, and sometimes that might be like scripting out your own exposure, or the scripting is really one of the best ways to do that, and I can talk more about that later. But know that, take the pressure off of yourself in terms of doing this on your own too, because it's a little bit harder. It doesn't mean it's impossible, but it is a little bit harder when you don't have someone guiding you through it. So I say that just so that you aren't thinking like, why is this harder when I'm doing it on my own? It is harder. It doesn't mean we can't do it. It's just a bit harder. Rachel, is there anything you wanted to say about this clip, or should we just dive right into it?
No. Yes. Cindy is amazing. I'm really excited to show you this clip with her. I think one thing that I really learned from watching Cindy is her incredible ability to self-soothe and use self-compassion in this moment. It actually taught me something because it's so helpful to watch someone else do it. Yes. Self-compassion, and so genuinely, authentically, like it really was inspiring. So whenever anyone's like, well, how do I incorporate self-compassion, pay attention to how Cindy does it, because I think she's great at it.
Yeah, awesome, great. We'll be paying attention to her self-compassion here.
Okay, Cindy, so we've been talking about how pain kind of in your shoulders can really act up when you are sitting, and kind of even more specifically when you're holding your phone and doing something on your phone, right?
Yes.
Yeah, tell us a little bit more about that if you want.
Yeah, it's often when I'm sitting with my phone or a book, but more my phone, my shoulders, my jaw, everything tightens up, and I'll get a headache. And then that's with me almost the rest of the day. It's hard to undo once I've gotten there.
Once you've done it. Yeah. And it seems to be this kind of conditioned response that happens. And you were pain-free when we started talking. And as we talked more and more about sitting and holding the phone, you noticed the pain started.
Got a little pain.
Yeah. Yeah. Isn't it funny how that happens? Okay. So we're going to just kind of do a little graded exposure right now and just kind of play around with it. And And, you know, like we always say, there's no pressure to change anything. We don't need the pain to go away or lessen or move. We're just getting super curious about what's going on, kind of more on the anxiety level and the fear level around this particular, yeah, situation that kind of causes more pain. Yeah. Okay. So here we are sitting. You've got your phone in your hand, right? There it is. And what's happening? What are you noticing? First, kind of tell me what you're noticing in your shoulder, as you said. And you can close your eyes or keep them open, whatever you want.
I'll close them. What I notice is almost like somebody's poking me in my left, just above the shoulder blade with a sharp poker.
Okay. Yeah. And this is kind of a really common response that you have as you sit there with your phone in your hand. Let's focus on your chest right now. Kind of any anxiety you're feeling, any tension. What do you notice? Do you notice any heightened anxiety as you sit with your phone right now?
I notice, well, that's interesting. Okay. I notice my heartbeat's a little accelerated. I'm noticing a little bit of tension in my cheeks. Yeah, that's interesting, which I've been getting a lot lately, and in my lower back and slightly in the top of my head.
Okay, so a lot is going on.
Yep.
When we start come up, and when we started talking, you were like, "Oh, weird. I'm sort of pain free. I feel fine. What are we going to focus on?" But as we got into this position, everything started heightening. Maybe the nervous system got on high alert. Oh, you're getting into this position that can sometimes cause you a lot of discomfort and disrupt your whole day. But yeah. Okay, so let's try to tend to that anxiety right now. Let's see what we can do to kind of nurture it, calm it down. Maybe you want to put a hand on your chest if that feels good. I know you have some good self-compassion exercises where you kind of, yeah, really, what can we tell yourself right now? You're a therapist. You're so smart. You know so much about the world. I trust your intuition. Like, what could you say to yourself right now?
Oh my goodness, sweetheart, this just really doesn't feel good, but it's okay. We're absolutely okay. And you don't need to protect me now. There's nothing dangerous happening here. We're fine. You need to relax, enjoy, just be a child and let me be the adult. It's all okay. It's all okay.
Tell me what's happening as you calm yourself down in such a beautiful way. We all take a note out of Cindy's book on how to be kind to yourself and really calm yourself. But what do you feel sort of as far as sensations go?
My kind of my yeah, just right above the buttocks, my left hip.
Mm-hmm.
But the more we talk about it, they come back. That's funny.
Yeah, they are coming and they're going, but right now you're just kind of calming the nervous system down. And you know, kind of logically, that holding your phone while you're sitting down is no more dangerous than sitting down. And what would feel safer if you were sitting down and just what would feel less dangerous as far as sitting goes if you weren't holding your phone?
Maybe that's it. Maybe, sitting is relaxing, and hypervigilant brain doesn't like to relax, doesn't like to be at ease.
Oh,
I think being at ease might be the actual trigger.
Okay.
That I'm not ready for fight or flight if I'm at ease.
No,
I don't know, but that resonates.
Okay, you're doing all the work right now, Cindy. It's incredible. I'm sitting back and watching. I'm taking notes over here. Okay, so you're coming up with a real beautiful discovery that maybe the danger is actually not from sitting. The danger is not from picking up your phone and reading a book. The danger is about allowing yourself to relax, to not be in this hypervigilant state, to not be in fight or flight. Is that feel right?
Yeah, I think that's why my upper traps are always tight. Is they're fired. They're ready.
Yeah, they're ready. They're ready for battle. Yeah, they're alert more than they need to be. So what can
Yeah,
we
dang.
do?
Cut it out, guys.
Yeah, what can we do to really tell your brain right now in this moment that staying calm, relaxing, being at ease, reading a book, picking up your phone. You said words with friends can be a trigger. That's a real like sort of easy pastime. How can
Hmm.
we tell your nervous system that that is actually safe, that those things are safe, that relaxing is safe? What can we do there?
It just feels so good, sweetheart. It's so good. So right. We need this. Let's let it be. Let's let this in. Let's go with it. It's okay. It's okay.
What do you feel when you say that?
Yeah, that feels good. I think my inner child just needs a ton of soothing.
Yeah.
I picture holding her with her legs wrapped around me and just giving her big hugs.
We all need a Cindy to be like that to our inner child. You're so good at tending to her. And yeah, she just needs to keep getting that message over and over and over again that relaxing, it's safe for her to relax. She is not in a dangerous situation anymore. Maybe she was in the past, in her childhood, past relationships. But right now, she is safe, and relaxing is not just, not only is it not dangerous, it's good for her.
Yeah, I like to remind her that people from our earlier life are gone. You know, they're not there. Not around to hurt her.
It's beautiful. Yeah, take a couple more breaths here, Cindy. And just really let that sink in. We're not going to completely change it today, but we're moving the needle in the right direction.
Everything's calmed down.
Amazing. You're amazing.
All right. It's so common amongst the population, those of us that get chronic pain, is that stillness, relaxation, quiet, those kinds of things can really scare us, both consciously and subconsciously. So in those moments, there are flare-ups. This is oftentimes why people, when they're on vacation or when they're driving or when they're doing things that they're otherwise not super occupied and busy consciously, their pain flares up. I say driving, I know driving can be unsafe for some people, but sitting in the car, oftentimes there's not a lot occupying our conscious mind, and that feels unsafe to us.
Right.
So it's very common.
Yeah. And did you guys see how good she was at self-compassion? Wasn't that incredible?
Yeah,
really,
she was
amazing.
Great at that. I just want to step back here, one thought about, for those of you that it resonates with, the idea of stillness or relaxation or being calm as scary. This is a common symptom of those of us that have experienced trauma early in our lives. I would venture to guess that many of you have some early childhood trauma or some trauma that happened at some point in your life that has taught your brain that stillness is unsafe. And that's something, I share that just because that acknowledgement can go a long way in helping us overcome that. That, oh yeah, I'm scared of relaxing here because when I was a kid, I would get hit when I wouldn't do my chores or something like that. Just a random example where some sort of abuse, some sort of trauma came in early. So keep that in mind, that is oftentimes the case, not always, but oftentimes the case, that it's because of that trauma that we learn that being in our bodies in a calm way is unsafe.
Once again, thank you to our participants, Amy and Cindy. You guys were awesome. Yeah, thank you, everybody.
Thank you so much, everybody. We'll see you next time.